We'll get there.
50?
Yeah, 50.
Only 50 people watched?
No, on the thing.
Oh, 5? I don't believe you, my little bag of bones.
We couldn't keep up with answering the
There's
questions.
just so many questions.
We did have a lot of
I love that
crossover.
was live.
Yeah.
Yeah.
You blind bag of bones.
There's one person watching us now. Well, we're letting the people get on. We started up. So anyway, welcome to another Cocktails and Conversations. We got cocktails, we got conversations. It's October, it's PT month, officially, right?
Yep.
Ooh, go PT month. So we wanted to talk a little bit more about PT today, like not just weird stuff like vision stuff. We're going to talk about PT, ways that we could actually hopefully give people a little bit more of an actual take home, something you could do right away, right? And so one thing that we don't really think about as PTs is that we can help prevent injuries. Most people come to PT after they have an injury. So what we do that I think is a little bit different is that the things that we look at can actually help people prevent injuries. But so that's kind of what the topic we want to dive into is more injury prevention. But I thought maybe since it's PT month, why did you guys get into PT? Like what? I mean, that's kind of what we do. That's our passion. What was it about the profession of PT that got you interested in PT? Or what was that really?
Oh, wow. Well, that's been 30 years ago.
I know. There had to have been a reason.
Longer than that.
Well, I knew I wanted to go into healthcare. I actually went, and I knew I didn't want to be a physician because I didn't want to work 80 to 100-hour work weeks.
Mm-hmm.
I went to nursing school, and I did not like it. And I liked PT because I had more autonomy, that I could kind of be in charge of a plan of care and I could still help people.
So it was because you wanted to help people.
Yep.
Right? I mean,
Yep.
There's going to be a theme, I think.
Yeah.
Right?
Generic answer.
Generic answer. But that's a reason. Jason, when did you get into PT?
Well, I was more in the athletic medicine field, so I was already doing kind of like what a PT did, but I wanted more of the, other than just sports-related injury type stuff, more extensive rehab type stuff, not like just knees and ankles and shoulders and hips. So other things that are more involved, I guess.
How long did you athletic train before you went to PT school?
I did it six years.
Okay. Yeah.
But you figure it out. You know what, I mean, the hours you do for athletic training, and very rewarding, but yet a lot more hours than a PT would do.
And on evenings and weekends.
Yeah, you're
Right.
7 days, working 7 days a week. So depending on where you work, but you're always at the mercy of.
I didn't want to just treat acute injuries. I said, okay, there's more to it than just taping ankles and rehabbing acute. Dave, what got you in PT?
It took me a while, actually, before I got to this point. I think you guys all know, maybe don't. I don't know. It's one of those things we don't talk about. But it was a career change for me. Originally, I went to school to be an architect. I don't know if everybody knew that or not. And it wasn't too long into school, and I realized I cannot sit all day long. And I'd be in a 2-hour drawing lab, and everybody'd be fast at work, and I'm like, yeah, I can't just sit here all day long. So did a lot of different things, and eventually, I'm not even sure truly what got me here, other than I think I remember watching a movie where one of the key characters was a physical therapist helping a guy, and I thought, well, that's kind of cool. I could do that. So I don't know. It's kind of one of those, I don't know.
That's how Dave runs his whole life. He just kind of shows up and he does whatever. That's all right. But yeah.
But I can't imagine doing anything else.
Yeah.
You know,
It's funny how you kind of end up where you belong.
Yeah.
No matter what.
Yeah.
And
I knew since 3rd grade I wanted to be a PT.
Because your aunt.
Because of my aunt. Yep. So she did a clinic rotation. She lived with us during the week, and she would practice on us. And I just remember her practicing, being like, "Ooh, if I push here, like you're gonna get numbness and tingling here." Like, and I was like, "Oh, this is cool." And then all my injuries and all that type of stuff. I've spent a lot of time with PTs.
which is kind of a common story. You've experienced the
flip
benefit,
side.
or you've seen the benefit, or you know the benefit of it.
But Tori's got to tell us his reason why.
Yeah.
Oh, I'm not gonna. Well, I grew up going to PT. My older brother has cerebral palsy, CP, and so from he's older than me. So from the day I was born, we were going to PT once a week. So I literally grew up once a week going to PT, and pediatric PT is horses and swimming pools and swings and balls and games, and it's fun. So I knew early on too. I was like, that's what I'm going to do, because you see that it helps people. Now in pediatrics, it's a little bit different. My first job was actually the same clinic that my brother went to. So when I got my first job out of PT school, I covered maternity there, and then realized pretty quick I didn't want to do peds.
I did a pediatric.
The voice
Oh,
is very
rotation.
high pitch.
And I'm like, I can't make everything fun. Like
Yeah.
40 hours a week, I can't do this.
Lori does. Couldn't make anything
I
fun.
want to make everything fun, but it wasn't the kids. It was parents, and it was schools, and it was the paperwork, and it was that kind of stuff. It's a hard thing.
Yeah.
And then when I was in college, after I kind of knew that I wanted to go into PT school, so I didn't apply to any of the colleges. I kind of knew which college I wanted. I mean, it was just like I just had that all planned out, which was a gift, I guess. None of my kids that are trying to figure out what they want to do with their lives. And then I blew out my ankle playing volleyball in college. So then I saw the kind of the athletic side of it. What does this rehab stuff look like? And so I think that's where a lot of us start is you see that people get injured, and you have an ability to help people and get them to feel better and function better. And so that's kind of our passion generally, is we want people to feel better. And then that's the big profession of physical therapy. What drew us all, I think, into PRI is it gives us a better methodology and framework to actually help people beyond that a little bit. And I think what's cool about having that framework is that it gives us an opportunity to really be able to help people prevent injuries. So just to segue into that, right? So it starts with, we want to see people after the injury, and then once you kind of know maybe why that was there, would it be good to not get those injuries in the first place?
Mm-hmm.
So that's where I thought, hey, this would be an opportunity for us to ask questions about what people, what injuries people have that they want us to prevent. So we had some Instagram feedback that we'll talk about. And if you're watching and you got comments and you want to comment, hey, what would be a good way to prevent this? Throw it in the comments, because we'll do that, even if it's, again, you're watching this replay later on. Comment, let us know, what kind of injuries that you're seeing and you want us to see, and then we can do more content later on. The rest of this month, we've all got kind of a diagnosis of things that we see a lot of. We want to give you some actionable things and how we want to prevent those things. So we'll kind of dive into that a little bit tonight to get some heads up. Hopefully by the time we're done with tonight, people have some ideas of, hey, this would be good things any of us could do to prevent injury, to prevent ourselves from getting hurt. So what do you guys think is like the, one or two injuries you think would be really easily that we could prevent, we see all the time? What kind of sticks out in your mind when we say injury prevention? We come up with a couple, but what's your top 2, 3?
I think one that so many people struggle with is back pain, and I think to me it's funny, and I think we've all seen it, the number of patients that come here that have been other places. Oh, I've had this nagging back pain for years and years and years, and nobody can help me, and we're like, it shouldn't, if you take out of the picture maybe some specific injury that you've had, a work-related injury or sports-related injury, but just pain that comes on for no reason usually isn't that hard to manage.
Yeah, back pain. I mean, the prevalence of back pain is just it's huge.
Right.
And it's just thing to do to prevent it. I think we'll get into that a little bit more. Anything else on that
I
one?
think sciatica or gluteal pain, butt pain, whatever you want to call it.
Mm-hmm. A lot of people get sciatica.
Yeah.
And when you see sciatica on your diagnosis list and the patient comes in, I think we have a pretty good understanding of why somebody has sciatica. Right? Which means if you know why it's there to begin with, then it's easy to, it's not that hard it can be hard to get rid of it, but it's not that hard to get rid of it. And it's even easier to think about how can we prevent it in the first place. You got one that you think of?
I would have said low back pain,
Yeah.
knee pain, hip pain, those are common.
Ankle sprains.
Hamstring issues,
Shoulder pain.
the number of people that come in and say, I have tight hamstrings, and by the time we're done, we hopefully have done a good job, but that's not all, it's not all what they think it is.
Yeah. I think plantar fasciitis is one that is out there a ton, and I think the things that people think help plantar fasciitis and what really helps plantar fasciitis, those kind of can be different. So that's one I think we can dive into a little bit.
Exercise-induced asthma.
Yeah, that's a good one. Yeah.
You know?
Exercise induced.
Right.
Or just asthma.
Right.
Asthma in general. You did a paper on that for a while. So, what would be maybe, so I think there's other things we'll dive into a little bit, but what would be, if you're out watching, I've got some warning signs maybe that I'm at risk for an injury. Because that's the kind of stuff that we would look at, right? What would be a good warning sign that you're at a risk for an injury?
Probably that you're experiencing pain or tension after doing an activity that's not like like something around the house or something minimal, like doing yard work, and it takes like, my back got sore, not doing anything major. And then, it kind of goes away, and it takes a few days to go away.
Yeah.
It doesn't go away right away. You shouldn't have back pain.
And a lot of us, especially Y chromosome people, 3 of us here, we tend to ignore those messages, right? So many people, my shoulder's sore for a week after I did that. That's not that big of a deal, right?
Right.
Until it becomes a big deal. So I think listening to your body and saying that that's a key one. You got any other thoughts, like things that?
I think just the onset of symptoms, just about any symptom that you don't have, there wasn't a mechanism of injury.
Yeah.
It's just, I started having a little back tightness. Oh, my neck's tight. I wake up in the morning, my neck is tight. Gets better as the day goes on.
Because the ones that we can prevent they're not the traumatic ones.
Right.
Because there's a lot of injuries that are pain that's there. Nobody knows why it's there.
Right.
It's idiopathic pain.
Right.
And so those warning signs are there. I also think that when you start to get sore, just to go to your point, in places where you didn't work out, right? I did that leg workout, and man, my back is sore. Or I did my arm workout, and man, my hips got sore.
Mm-hmm.
Right? You didn't get sore where you thought you should get sore, right? Or not even from an activity, but from workout.
Or if you think about repetitive strain injuries, your tennis elbows, your plantar fasciitis, and all that stuff, and then you're doing something repetitively.
Yeah.
So if you just change that repetition
in
some shape or form, you probably wouldn't have it. It could be your tendonitis is basically what I'm getting at.
Yeah.
A lot of that stuff could be prevented, but they don't know because they already have it, and we're seeing the aftermath before it even.
Yeah, and that was good one. So a lot of that comes from the posture that you put your body in when you do the repetitive activity, which I'm going to get into kind of what kind of tips would we have for people to prevent injuries. And that's part of it is what position you put your body in when you do it.
The pattern that you're doing.
You're doing it. All right. Well, so the kind of the 3 big ones that we got comments on Instagram were back pain, which that's it. Specifically debilitating QL pain, but back pain in general. QLs are muscles in your back that get really tight. Shoulder pain, particularly with overhead athletes, and hamstring pain. So people are that's what people had questions about. That I want to make sure that we hit here, and then we'll kind of dive into some of these other ones. So you brought up, Dave, when you think about back pain, what would be something that you'd want to do to help people prevent back pain?
Well, pretty much anything where we can promote getting into what we call a state of flexion, kind of getting the ribs down, back rounded. So often people are doing activities and you'll see them, their ribs are up, their chest is up, and so their back muscles are just on. They're always on. They don't shut them off. And so activities get a person rounded or in a squatted flexed position.
Yeah. To think about position of not just the stretch of your back, but of your spine.
Yep.
Well, I think too, if you see any kind of healthcare professional or even any therapist for that matter, if you have back pain, there's 2 things they're going to tell you. They're going to tell you to get your abs stronger and stretch your hamstrings.
Right.
And
if you Google it, right? That's what
it's told. But our philosophy is a little different. I mean, you still want to get your abdominals, but you want to make sure that pelvis is in the right position before you start stretching the hamstring. If you start stretching the hamstring, you make the back pain worse.
Doing a segue into the hamstring thing.
It's the same thing.
I mean, specifically about QL pain, your QL muscle attaches from your rib cage down to your pelvis. So if you're having right-sided QL pain, you actually need opposition from the left ab. right QL pain is very common. It can be weakness with the left ab. It could be weakness with your right glute, or it could be inability to rotate your trunk to the right. So some of those things are, you know, making sure you're neutral, making sure you have a left side of your body, you know.
So when somebody comes in, they already have QL pain.
Yeah.
We've already got mindset that says we want to make sure that we got glutes that are strong and abs that are strong, and we know kind of which way we go. We're going to prevent it from getting tight in the first place.
Right.
Let's make sure that you keep good ab position for
Yeah.
your rib cage
Right.
with abdominals. Make sure you can breathe well, making sure that your pelvis is in a good spot.
And when we're talking abdominals, we're not talking 6-pack abdominals.
We're
Because
talking
everybody
your
is
outer abs.
Raised, we're
Yeah.
talking outer abs.
Yeah.
So you don't think
Like-
6 packs is a healthy person?
Not necessarily.
I tell my patients that I don't know how we decided that 6-pack abs was a sign of health.
So it looks good.
Right? So if you want to look good, that's fine, but is it a sign, but that's what we think
Right.
is healthy. You go men's
Yeah.
health, women's health, whatever, 6-pack abs is what's on there. So I don't think 6-pack abs is necessarily a preventive measure for back pain, right? But people say,
No.
if I keep my core tight, if I keep my abs tight, keep my 6-pack, I won't have back pain, and that's not,
It's not.
that's not necessarily true. It's the overall position, right?
I would also say a lot of people, when they come in with back pain, think that they have a weak back. And they
Right.
don't.
Yes.
Your back is overworking because you don't have enough opposition from hamstrings,
Right.
glutes,
Mhm.
and abs. And you need more stability. Your back is doing all the work because the other muscles either A, are in the right biomechanical position to support the back, or B, they're weak, so the back is overworking. In my 30-year career, I have not met a weak back.
I
Yeah,
have
there's
either.
such thing.
Yeah.
I would just put that out there.
Yeah, I think that's a great point, a great discussion that it's out there all the time, even in fitness programs and everything. We got to get your back stronger. We got to do
Right.
Supermans and glute bridges and
Cobras.
back
Well,
extension things.
And just like Dave was talking about hamstring strains, a strain is overuse. You're overusing something, that's why it's being strained. If you're straining something, you're
It's
overusing
Or you're using
Yeah.
it from a bad
the
position.
position. So what you gotta do is you gotta find other muscles to take that overstrain off the muscle that's being strained to decrease the injury.
So I've said it, my patients, if you ever find somebody that has a really good abdominal wall and a really flabby back, send me a picture because I want to see it. But I've never seen it, right? And if I see it, that's okay. No. The only backs that I would strengthen would be backs that have been surgically cut or they have, a disease. So there are things that happen. But yeah, I don't think there's any reason to strengthen a back.
Right.
But that's out there. So back strengthening is not an injury prevention activity. That's what I say. So making sure that you have good postural alignment. This is what we're going to get down to as we look at all this posture, all this injury prevention. Is your body in a position to not strain your back? Why would you strain your back? Because you're not in a good position. Right. So getting pelvis positioning, getting rib positioning is a key thing. So Dave's tip of let's just make sure that you can get your ribs down and get your back out of an extended position. That would be the best injury prevention thing that we would think. So if somebody's got a tight hamstring or a pulled hamstring, particularly Miami wanted to know about the left one because she's got a PRI background. What would be the things you would think of to prevent a tight or strained left hamstring?
I personally would go after the left IOs and TAs with the squat because your lower abs help get your pelvis to pull back. If your pelvis comes forward, your hamstring attaches here. And the pelvis is being pulled forward, that's going to pull on the proximal attachment side of the hamstring. Your abs help to pull that inlet back to help take stress off the hamstring. I would not do like a hamstring
She's
type
talking
of
about
activity to
proximal
start with.
hamstring.
Yeah, proximal
Right.
hamstring.
Yeah, I would not do a hamstring activity to start with because it's already aggravated
aggravated.
because it's working in a lengthened state. So by doing a posterior pelvic tilt, by engaging more inlet extension and getting more ab work with quad work will help to get the pelvis in the right
Offload.
position, but
Yeah.
then
The
also
hamstring.
to take stress off of the proximal hamstring.
So our PRI people know the left hamstring is the hamstring we like to engage.
Yep.
to stabilize that pelvis. It's one of the first muscles that we learn to go after with what we do. But which is why it's often at risk
Right.
to be injured. So it's a good device. It says if you got that, that's not the spot we're going to go after. We would go after, like I said, positioning of the pelvis and the ribcage above it, and with an abdominal program. Right? Now, what would be a traditional hamstring issue? Go stretch it out and put some needles in it and rub it and whatever, which is probably not going to get you anywhere. Actually, right now I got a football player I'm working with that's got a left proximal hamstring strain, and that's what we're doing. We're going after abs, and he's got a good ab program, and he's still trying to play football, so he keeps aggravating it. But we've got him in a position where he's got good position. He just still hurts. We got one more game. He's going to try and get through it, but it's a pretty common spot. Now, if somebody had a right proximal hamstring strain, we think a little bit differently about a right one. What would you think about a right hamstring strain, Dave? Which is why when I asked with left hamstring, it's a different story. A lot of patients don't even really know. Well, okay, which one side hurts? So right hamstring strain. What would you think about that? Right abs?
What's that? Right
abs?
No, I would want to get them over to the left more. I'd want to get some glutes. I'd want to make sure they have good shoes on, because if you don't have proper heel strike, your hamstrings aren't even getting the proper signal of when and how to fire.
And a right hamstring, I go after the left.
Then you go after the left hamstring.
Right.
Yeah. That would be different.
Yeah,
left hamstring, left ab, right hamstring, left hamstring.
You get probably 3 different answers. Yes, I'd go after the right glute, and I'd go after the left adductor. So
right.
Yeah.
So
but the
with the proximal hamstring
on the right.
On the right.
Yeah.
Yeah. Well, left adductor is medial hamstring.
Pulls you over
Yeah.
the left.
Well, I think one of the key things that's coming up too is we're asking questions that I don't think you get at another clinic. What would you do on the right? What would you do for the left?
Is it different?
Right.
Yeah, we have a different mindset. So once we have that mindset, we say, okay, what would we do to prevent any hamstring strain?
Right.
Well, have good, strong hamstrings on both sides. Good position of your pelvis with abdominals, inner thigh muscles, and glutes, right? So it's not just we got to do a bunch of hamstring work to get hamstrings stronger. So all the hamstring prevention programs,
right?
Nordic hamstrings, which is a good activity, but that's the standard for injury prevention for hamstring is just do hamstrings and stretch them out. And so our thought would be to prevent hamstrings or prevent backs. It's about position of the pelvis first. Right? So that's one answer. So and how would you know? Well, we have some testing that we would know, but we would want to keep balance between the two sides. So position of the muscles first is what prevents injuries, right? All right, so that kind of hit low back, hit hamstrings, proximal left for Miami, and then right just because it's different. What about overhead shoulder? That was the other one that people wanted to make sure that we talked about while we're here. What do you think with particularly overhead athletes or shoulder pain in general? How would you prevent shoulder pain?
I think rib cage.
Yeah.
Yeah. Position of your rib cage.
Yeah.
And how your shoulder blades.
How does that work? What does that mean?
Well, they need more IOs and TAs.
Because people say, what do you mean my ribs?
Well, if it goes back down to.
Should I just do some of these guys?
Oh, yes.
It goes back to the position of your pelvis.
Right.
And how your pelvis is positioned in relationship to your rib cage. And if your rib cage is still up and your ribs don't go down and follow, I always tell people if you have a pair of scissors and your scissors are closed, your rib cage is on top of your pelvis. But if you have an open pair of scissors, your pelvis is going forward, your ribs are going up. So what you got to do is you got to get the rib cage down to get that parallel so that your shoulder blade can sit on a properly positioned rib cage. So then your shoulder joint, your actual shoulder joint can work in an appropriate manner. So you don't have impingement, you don't have the tendinitis or whatever. Yeah. So I think that's just a long wise tail orthopedic thing is you have shoulder pain, you work on the shoulder. That's one thing I guess PRI has really kind of exposed you. You can't just focus in just on the shoulder.
That's medicine in general.
Right.
Because a shoulder problem is a shoulder problem.
Or a knee problem, but but that's one thing that I think that's really we're going to focus on. I mean, if you can show a patient if you just push the ribs down and have them bring their arm over their head, they're 9 times out of 10 the shoulder pain will resolve.
They're rotationally better. That's one thing Dave's going to show us. You watch out for it. This rib position and shoulder movement is linked together. And most people don't even realize that. So when you say rib position, rib spot, what would be easy things people would do to work on rib position to help prevent shoulders?
Yeah.
Well, they already is, right?
Right, yep.
Ribs down.
Keeping the ribs down
Slouch.
and kind of like what we talked about earlier, in particular, we'll think about that left side.
And then,
Breathe.
Yeah.
so shoulder problems are breathing problems, right?
And breathe without having to go into extension to get it.
Yeah, yeah. So proper breathing mechanics, proper respiration mechanics would be something good. So if you wanted to give somebody a preventive program for shoulders, I'd make sure they're really good at breathing, and the muscles that they breathe with, abs and diaphragm muscles, are in a good position and are strong enough to handle that.
Mhm.
So which is why we use a lot of balloons.
Right.
So just about all your shoulder patients, at least mine, probably get a balloon at some point
Mm-hmm.
because they got to have rib position.
Mhm.
So,
Be able to do it without a neck.
yeah,
You know, that's the other thing is a lot of times when people don't breathe well and you watch them try to take a breath in, you gotta keep an eye on them because they will start pulling that rib cage up.
So maybe we could say this. Okay, so if somebody has good breathing mechanics, what other injuries would that prevent? How about let's flip that coin and say, okay, we're gonna work on. We said, well, if we have a good pelvis position, that could prevent back pain, that could prevent hamstring strains, that could prevent hip impingements. We didn't talk about that, but that's one of those things.
Mhm.
Proper breathing mechanics. We're saying, well, that would be good for shoulders. What else would be good for it?
Headaches,
No.
I was just gonna say headaches and that.
shoulder, headaches and neck tension.
And we did a whole thing on that. Yeah.
Mhm.
That's, so when you bring up breathing, why would you prevent asthma? Well, it's because it's a mechanical issue.
Right.
Mid back pain.
Mhm.
You get this guy right here
Right there.
Right on
Right on
the
the inside of that
on
shoulder blade.
the right side. Make a living off of that guy.
Right.
So that's one thing that I think is cool about PRI stuff is that just addressing breathing mechanics, which we do a lot, can prevent lots of things.
Mhm.
Mhm.
Which who doesn't have neck pain? I mean, a lot of people have neck pain headaches, but it's a
Jaw
it's a
pain
big
too.
Jaw pain, right? So if you're doing a tough cuff shoulder program as an athlete for overhead athletes, and all of them are doing these band things
They're always
to get their rotator cuff
Mhm.
strong, right? But as an injury prevention tool, right? I'm not saying it's bad, but it's incomplete if they don't have good mechanics of breathing underneath it.
Right.
So don't not do those things, but make sure that we're doing breathing. So foot pain, ankle sprains, somebody brought up plantar fasciitis, shin splints, kind of lower body pain, I think are things that can be fairly easily prevented. We see them sometimes when they're chronic and that becomes
Mhm.
a
Ankle
long-term
sprain is an
injury.
ankle sprain. If you're gonna sprain your ankle, you're gonna sprain your ankle.
Yeah. I think what were you thinking when you said prevent ankle sprains? Because you brought it up.
I said it.
I was gonna say, I think,
Yeah.
yeah.
Shoes.
Yeah.
Shoes, yeah.
Footwear.
So you walk around in flip flops might sprain your ankle. Right. Which was going to get us into it, and if you guys follow us, you know that we're big into footwear because it can help with some injury prevention. How?
Sensing the ground.
Yeah.
All these shoes are extra cushy.
Through understanding where you're at in space.
Right. Being able to engage proper muscles at the right time. If you don't
The brain's ability to feel the ground, your heel arch and big toe underneath your shoe, affects your movement strategy and your posture as you move. So wearing shoes that don't have good arch support can cause plantar fasciitis. Having shoes that have poor calcaneal support can cause Achilles tendonitis.
Shin splints.
And the other thing, the younger generation, I'm not saying everybody, but you guys like to slip your shoes in and out, your foot in and out of shoes. You don't like to untie and tie your shoes.
Mm-hmm.
And then your heel can slip. And that heel slippage, your plantar fascia attaches on the bottom of the heel, your Achilles attaches on the back of the heel, and that can create inflammation of those areas.
You just had 4 things, and people get this one. You maybe hit your 4 highlights to prevent. Did you do foot pain?
I did Achilles tendonitis. My highlights were pelvis position and respiration, because if your pelvis and your ribs are up, it causes I did it in the video,
Yeah,
but
so there's gonna be a video coming out later this month.
Yeah.
Keep an eye out for it. But highlights:
But if the pelvis is
Pelvis
coming
and
forward and
toes.
your ribs are up, your weight's gonna be on the ball of your foot, which is gonna be no different than walking around in a high-heeled shoe, and that'll put pressure on your
The
Achilles
Achilles
tendon.
will, and not because it's trying to hold you up, not because
Yep.
it's a.
Then I talked about heel sense.
Yep.
Can you sense your heels on the floor? Because I don't want your body weight to go on the ball of your feet. If you can feel your heels on the floor, that'll help to prevent plantar fasciitis, Achilles tendonitis.
Yep.
Talked about footwear. And what's my fourth thing? I forgot. Ribs, respiration, heel
Oh, you didn't
sense.
say ribs. It was
Calf
ribs.
inhibition.
Huh?
Calf inhibition.
Oh, yeah, calf inhibition. Thank you.
Yeah. So
And-
calves are one of those muscles that are, I tell people, you have lots of muscles they're superhero muscles. Meaning they'll do things that other people are supposed to be doing.
Yeah.
But they're cranky about it.
Yeah, well, I mean, they
So
will
calves
work
will
for
do-
your
Mhm.
butt. They
Right.
could be your butt muscle, they could be your hamstring muscle.
Mhm.
So calves, they'll do it. They'll be your butt, they'll be your hamstrings, they'll be your low back,
Your back.
right? They'll be your calf, right? So they're doing
Greg
four
calls them
people's
your-
jobs.
Your southern
Yeah.
glutes.
That's how we get tendonitis.
Great. Different from- Your calves are your southern glutes and your back are your northern glutes.
I like that.
Thanks, Greg.
Your friend, I said that, your friend patient was walking up and down the hallway at the dental office today, and I said, hey, look at her glutes. Because she's got calves. She's a ballerina.
Yeah.
She's on her toes all the time anyway, but her calves are massive.
She's on her toes.
She's on her toes. A, she's a ballerina. B, she doesn't really have control of the ground because she's got lots of other issues. But she's got, her glutes are between her knee and her foot. So
Good southern glutes.
yeah, so you prevent Achilles tendon issues not by stretching Achilles tendon, and not just by stretching calf muscles, by turning them off, by making sure that the rest of the teammates are working. So footwear is a big thing. Ankle sprains can also be prevented if you know how to hold your body up, not stuck on one leg over the other. So if you think your center of balance is supposed to be on your right leg, that right ankle is at risk to be sprained. So that's what I'm thinking when you think about how would I prevent a right ankle sprain? Why make sure that your body could go over to the left side?
Mhm.
So unfortunately, we don't get the opportunity to do a lot of preventive stuff, but we see people that get injured, and then we want to prevent other injuries from happening. So I think part of our program that we do, hopefully, isn't just let's take care of what hurts now, let's put your whole body in a position to prevent other injuries, right? So what are some tips that you guys give people long-term to manage their body position, like things you do throughout your day? So we can do just positioning ideas that would be good preventive activities for any of those repetitive strain issues, or postural like elbow tendonitis things. What kind of tips do you give people just for day-to-day activities to prevent those strains?
I always tell people the knee-to-knee exercise, that's just a good exercise plus a test because it checks your frontal plane. So a lot of times people will go through a program, they feel better, but then they stop doing their exercises. That's just human nature. You start feeling it's one more thing on your plate to do. But I have them as a preventative measure. Most of my runners, I'll say, just lay on your side, see if you can lift your right knee, bring your left knee up to your right knee. If you can do that, you're probably in good shape. That's your frontal plane. But if you don't or are unable to do that, something's going to start to kind of, it could be your back, it could be your knee, it could be your hip, it could be something that's, you lost your frontal plane.
So it's an activity you've given them to do,
That they added an exercise.
that has an exercise that you can go back and say, if you can maintain and do that exercise, you're probably keeping your body in a pretty good position
Yes.
of these other things that we're talking about. So if you can check in with that
I
activity.
have them do it once a month, the first Tuesday or whatever, first Monday of the month, just check it out. And
Do you have any other exercises you have your patients do, just long-term, easy ones that?
Most people have stairs, so
Mhm.
incorporate something with any of the PRI stair.
just shifting.
Yeah,
Yeah.
just shift, being able to go up stairs sideways, leading with that left leg, go backwards, leading with the left leg.
I use the retro stair a lot
Yeah.
as my kind of, this is what I want you to check in on.
Right,
Yep.
Can you go backwards? Can you get your weight on your left leg as well as you can on your right leg?
get that heel down.
Can you get your heel down? Does one side feel tighter than the other? Does one side feel looser than the other? And then can you pick your foot up and balance?
Right.
The same on your left and the right. And then when you push, you have as much strength on your right and on your left.
Mhm.
And if you don't, well, then you kind of know probably what activities you should do. Do you need more flexibility on your left side? Do you need more strength on your right side? Is it but if you can do it, you can kind of maintain that balance between the two sides. That's a good preventive tool, especially for runners. That's one I like to use. I mean, you've got lots of favorites that you use.
Aside from exercises, I just have my patients make sure they have an attitude about their left arm and left leg.
Yeah, that's where I wanted to go next.
So, you know, you can stand on your left leg throughout the day, making sure your left hip is back, get up and down from a chair with your left leg, kind of stand on my left leg and reach into the dryer and pull clothes out or reach into the cupboard. Just
start eating a living hand.
It doesn't mean being on your right arm, you know, using your right arm and your right leg are bad, but just let your brain know you have a left side too. I mean, getting up and down on your left leg, you're shifting back to your left hip, you're working your hip, your glute. And it's easy stuff that people can do throughout the day.
People, before they work out, I give like squatting bar reach.
Yeah.
So that's what I thought you go, Dave. I mean, you get everybody make sure they can
That's
squat.
one of my favorites.
Yeah.
If you get in a squat position and hold that and breathe and not have tension,
Right.
you're probably good to go.
Right.
Before or after activities. And then if you're a human, which most people watching probably are, right?
Never know.
You're probably gonna have, not probably, you will have a biased tendency to the right side.
Right.
Right, and we're not gonna really debate it, but that's how it is. So that's why having a thought of, well, let's just make sure we have an attitude about your left side. Whether it's, I'm gonna use my left hand, I have people look at your desk setup. How can we get your desk set up in a way that doesn't bias you to one side or the other, doesn't reinforce bad habits or bad tendencies?
Jordan's got a bad habit going on.
Right here.
Well,
No, Lori, Jason, me.
Yeah.
but you know, another thing is just like in everyday life, like my husband and I will switch which side we sit at the kitchen bar to have dinner, or sit at a different spot at the dinner table, sit in a different spot on the couch or your chair, because we all
I've got my spine on the couch and it's like this.
Yeah.
And
I mean,
it's true.
doing
So I have
stuff-
to make sure I go to the other side of the couch and sit like this for a while,
Yeah.
because it's too easy just to sit like this all the time.
Yeah. So I just think the more you can kind of mix up habits or ways that, you know, sit in a different way, sit in a different spot.
So it doesn't have to be PRI friendly. I tell people, if it's something you do all the time,
Right.
Just do
Yeah, to do
opposite.
something else.
Well, it's just like,
Yeah,
I
do it the other
tell
way.
people, drive a different way to work.
Yeah.
Don't go the same route.
Yeah.
Go, I mean, because if you think about it, I mean, well,
Well, we live in Lincoln. You can't.
It's driving more to people.
but
about a month and a half.
but sometimes take a different route, which changes your brain.
Yes. Well, have you ever like driven home and all of a sudden you're home and you don't realize that you got there?
Yeah.
Yeah.
Right? I mean,
Well,
that's just me.
What are you doing?
I know that might work.
Because it's the same
You
it's the
go,
same
yeah.
routine. You're just
Yes,
so
you're tuned to it.
in tune with it, you don't really even pay attention
You just get there.
because you just get there, right?
You don't even think about
You
it.
don't even think about it. It's automatic. So the habits like how you sit on the couch, whatever, those are habits that reinforce potential things that could cause you to have injuries over time. So being mindful of the way you hold yourself and the way you do things would be a great injury prevention type of activity. So what would be a way that you'd think that as a profession we could be more proactive with injury prevention?
Well, my patients, when they leave, I try to tell them, think of me more like your dentist, that if you want, do a check-in in 6 months to a year and just come in. It doesn't mean that we have to do tons of PT sessions, but let's just do a tune-up. Let's check your shoes, because they've all kind of learned like, hey, shoes matter and they're changing all the time.
Yeah, let's check
And
your shoes out.
just-
Buy a pair of shoes.
Let's see where you're at. Do we need to focus on something to make sure that you stay good so you don't need me?
Yeah.
One visit is better than potentially 5 or 6.
And one visit every 6 months to check in and think about prevention, which we do. I know you do. I know you do. Could save you from having a bad injury that's going to cause you to have to come to PT for 10 or 12 visits.
Yep. Yeah.
Right?
I have runners that come in and check before they start training for races and stuff. I mean, like clockwork January or February, they just want to check in and make sure they still look good.
So I wish PT was more like that
Right.
than it was hey, we should check in and make sure that you're doing a good job. And so if you are a patient, you probably are doing that. If you're not, it's not a bad idea, even if you don't hurt, if you're having these warning signs. Well, I get sore in places I shouldn't get sore. It takes me a long time to recover after I do get sore. I've got muscles that are working harder than I think they probably should. Maybe it'd be good just to check in. It doesn't have to be hard. It's not hard stuff.
Right.
But there'd be ways that we could help prevent things from happening. And we're not trying to get like, come in and see us a ton and spend a bunch of, but the prevention is worth it. Right. And I think
too, and I'm not trying to toot our horns by anything, but I think we as a PRI professional, we do very good in education. So I think the better you can do in education, you're educating your patient to understand why things are happening versus just accepting you have knee pain.
Right.
I think they already kind of know, or sometimes they go into a panic mode, like, well, something's not right, and it may not be something really bad. It's just some little tweak that you have to do, but they know enough to know that the first time it happened, that we had to do all this work to get it. But they're very good at, once you educate that patient to know what they need to do, that's prevention in itself. So education.
That's how you come back in.
So I had a patient, I saw her before for shoulder pain, and she started to have plantar fasciitis pain. She said she let it go for a week. She put on some different shoes, and then she goes, I'll just come back. And it's her orthotic. An insert that wore out, put a new one in, pain gone.
Because when that plantar fasciitis gets raging, it's
hard,
you
know, but she was like, I knew I just needed to come in, and it wasn't gonna let it go long, but she was like, you educated me enough to know that if something happens, just come. It's easier.
Pick up, we did not get toot our own horns, but I think that is what's different about what we do is that we do have an idea of why you got hurt the way you did. It's not you went somewhere because your knee hurt, so you did knee rehab because your knee hurt, because that's kind of the model. We're going to really dig into why it hurt in the first place. And so when you have that education, it's a lot easier to prevent it from happening in the future. So for PT moms.
So the patient's almost like their own advocate.
Right. Yes. Our patients know, and hopefully they can, like I said, say, for PT month, I don't want to go to PT for getting hurt. I want to go because I actually want to not hurt later. Or even better, I want to do better at what I'm doing. I want to run faster. I want to run longer. I want to be healthier for longer, those sorts of things. So PT is not just fix injuries. At least it isn't here.
Right.
In some places it is.
Physical torture.
Yeah, in some places it is. It is pain and torture. We'll do pain and torture every now and then, but what we're doing for PT is not pain and torture. It really is mechanics and hopefully injury prevention. But nothing drives me more bonkers than having a patient that comes in and they start to feel better pretty quick, and then they stop coming.
Right.
Well, because they think they're fixed.
Yeah, because we haven't really gotten to the thing that's going to actually prevent the injury from coming back. It drives me bonkers. Like they got better too quick. Dang it! I wish they would go back. Not really, but
if we were going to summarize for everyone, I think the bottom line is pelvis position, wrist position, respiration, good footwear, and getting your body to alternate and on the left and the right side.
Two sides.
And that would do a lot to prevent a lot of injuries.
It's not hard, right?
Yeah.
This way, it's going to be we didn't plan much. It'll be an easy discussion. So nobody had any other injuries, which is fine. Thank you guys for doing that. Keep an eye out for videos. We'll at least be doing something. So hopefully we'll get more actionable tips that you guys can have. If you see us and you have some specific things you want us to look at, always reach out, right? We can answer as much as we can. Or if we need to get you in to see us for a preventive thing, if you're in town, great. If not, go see your PT, especially a PRI PT, because they will help you with injury prevention. Keep an eye out for pumpkins later in the month.
We are competitive.
We've got our
Very.
I put the trophy up there.
So he's got 3-peat on there.
Yeah, so I got
4-peat.
I grew in the 4-peat in a row.
So I got 4 out of 5. So you guys asked this one if I got my thing, and the answer to the question is, well, do you want a chance to win this year, or do you not want a chance to win this year?
Man.
I got a couple ideas. So anyway, pumpkins will be coming. So I know you guys have been following us. Every year we do a pumpkin contest. So that'll go out at the end of the month. So hopefully you enjoy it. Next month when we're here, we'll probably
pictures
or you'll see the winner of that. But that's something fun.
I'll be at Cabo.
I'm gonna miss out.
I know, but if I win,
But
I'm
everyone
gonna
win anyway, so.
zoom in.
Yeah. It means you gotta win.
One-
Is
one-
your name up on there?
We have a
One
trophy,
easier- one
trophy
easier
for our
question.
name.
Say on there must be present.
I know second place, remember?
Bridesmaid.
Yeah.
All
All right.
That's good. All right, one, I'll have to go back to this. Could you diet have an impact on pulling you into BC pattern, et cetera, aka stress leading to body changes? Is diet a way to prevent injuries? I guess would be a good way to ask
Yes.
answer the question
Yes.
for Jackson. Thanks for asking the question, Jackson.
I think the other thing too, we didn't bring up, and we've
Yeah.
done this in the
We talked about
past,
respiration, which is a systemic.
as far as if there's sports clubs or whatever, like we've done it with swimmers, we've done it with soccer players. Dave's gonna be doing stuff here in December with the police
Yeah,
department.
yeah, that's good to highlight that.
I think if there's something, like doing some screenings, if there's anybody that ever wants us to do screenings or whatever,
Yeah.
just to prevent.
So, I mean, you're not
I mean, it's
saying
just-
anything
it's
specific,
preventative.
but what are you doing with the police, Lincoln Police Department?
Well, I know I have some friends that are on the Lincoln Police Department, so I just reached out to them, and I'm gonna have an opportunity to,
You're gonna touch
over the
on
course of a
people.
couple of weeks, be able to, I think, really have a talk with small groups and ultimately all the police officers, and just kind of introduce what we do, why we look at what we do, how can they
to
prevent injuries.
Yes.
Yep, and, yeah, I'm looking forward, I think it'll be a really good
So,
interaction.
so if you're out there and you've got
Volleyball.
a volleyball team and you say, hey,
We have
I don't want my
injuries.
volleyball people to get injured.
Or if you start
Yeah.
seeing a lot more
You do that all the
patterning
time.
of certain kinds of injuries, you might see shoulder injuries or more knee. There might be something that you're doing practice-wise or training-wise that might be doing that, and it's just some little tweak that can resolve
Because
that.
it'd be hard, but that's a good thing. Ann's
Well,
gonna
it's a-
interview somebody later this month. You're interviewing Liz,
Liz. Yeah.
she's a PRI person,
Mhm.
PRI trainer. That's her job, is injury prevention. So they're gonna be able to sit down and talk about how she works with what she does in her job to really just utilize these kind of concepts as her primary role. So hopefully there's good information coming out. As far as diet is concerned,
I've seen that with some of my patients, is it Jackson?
Jackson, yeah.
I've seen that with some of my patients that they have like allergies,
Mhm.
or they get inflammation,
Sensitivities, yeah,
because that can increase their cortisol levels, which can affect their autonomics.
which is gonna put you into.
So
a
I
pattern
have
and get you out of
seen
a-
diet and, affect, the
Posture.
neurological system, which can affect PRI testing.
Yeah, affect your child. So it's definitely a thing. I don't think it's the top thing that we would say that
No.
we're gonna
No.
Due
First
to
thing, diet,
prevent
diet,
injury,
prevent
but
injury. But certainly if you've got a crappy diet, you're probably at risk because you don't have the building blocks to repair. And if you're hurt, you should get protein and that's just good thing, but not specifically what we're looking at as far as what we do. But good question, Jackson. Thanks for actually commenting. Appreciate you. All right. Anything else you guys think? I think this.
what are we doing next month?
I don't really have a topic for next month. To be honest with
Haven't
you,
nailed it down.
it's November. But we've talked
In
about
2
some
more
things.
months.
Dental?
We talked about it. I want to sit down with Megan, so we
With
might
Dr.
talk about
Megan.
Megan, but we don't sit on top of her. But we had talked about scoliosis potentially,
Mhm.
because that's a thing that's out there. But that just speaks to kind of how we look at the human body. So it might be a scoliosis thing. If you guys have a topic that you'd like us to talk about, certainly let us know. Otherwise, we'll come up with something. But thanks for asking.
Nice to put you on the spot.
Yeah, we'll figure
All
something out.
right,
We'll figure something out.
We'll figure something out. Maybe it'll be so you.
Cocktails.
Football. All right. Thanks, everybody. Have a great week.
Bye.
If you like this, if you have good thought, let everyone know that we're watching and you're getting some value out of this. Let us know you're getting value out of it. And we appreciate you watching. Thanks so much. Take care, everybody.
Was Roy P.